Hello, everyone. My name's Anthony. My colleagues Julie and Rachel will be presenting on parish nursing or faith based nursing today. So, let's talk about the history of faith based nursing. In the 1980s, diagnosis related groups determined how much money an organization should receive through Medicare. So, patients were discharged early according to these reimbursements, and sick patients were left to their own care. 3 years later, Lutheran chaplain Granger Westberg, along with his colleagues, hired a nurse to care for church members who had been discharged early from the hospital. Westberg believed that nurses made the most natural connection with church members. As a result, faith-based nursing was adopted in many church organizations to provide screenings, to prevent health issues, and visits to the hospital. Faith community nursing bases its care through international care of the whole spirit, body, and mind. The American Nursing Association later recognized faith-based nursing in 1998, and its focus promotes whole person care throughout life. Moreover, faith community nursing utilizes evidence-based practices to address spiritual, physical, mental, and social health issues among the broader community. These practices include praying, compassionate presence, active listening, advocacy, counseling, referrals, and most importantly, active listening.
My name is Rachel, and I'll be talking about the purpose and population served by faith based nursing. Faith community nursing serves in an on site office or visit members in a healthcare facility, private home, or other community setting. The purpose of the faith based nursing, according to the American Nurses Association, is to promote the whole being, whole person, and focus on faith, harmony, and wholeness.
So, how this nursing specialty can change health outcomes for the specific population. They so how this nursing specialty can change health outcomes for the specific population. They can provide access to local resources and social supports, such as they may meet with individuals visiting a church staffed soup kitchen and provide them with information about job training, low income housing, or other appropriate community resources that can boost well being. So they don't only focus on the physical aspect, but also the emotional and spiritual well being, and they can focus on chronic health conditions and lifestyle changes. So instead of just giving them medication or things like that, they can provide information about health risks for different diseases and conditions such as diabetes or tooth decay, as well as guiding people in behaviors that can address those risks. Faith based nurses help individuals and provide the tools that they need to stay healthy or recover. They can also promote spiritual care. So they may pray with the patients or maybe talk about shared beliefs, and they can also refer them to communities and churches that the nurse may feel will benefit their spiritual health. And they can also promote mental health. They can organize mental health meetings or counseling. They can refer them to like grief support groups, and they also refer them to mental health specialists, psychiatrists, whatever it is that they need resources for. Some nursing organizations that the nurse could look forward to joining, being a faith based nurse, is the Faith Community Nurses International membership. Organization helps parish nurses network, conduct research, and educate. They have a yearly membership of $55 to become a member. On the other hand, the International Journal of Faith Community Nursing is a free they have a free newsletter to support the practice of parish nursing using evidence based articles and current faith community nursing research, as well as the International Journal of Faith Community Nursing. So they have an $80 annual student membership, and this is something to look forward to if you're learning about what it means to be a faith based nurse. Next, we have Health Ministries Association. So, this membership provides access to the resources and tools you need to help innovate and inspire the promotion of faith and health. The standard membership is $105 annually, but the student cost is about $70 annually. They provide scholarly articles about grief and understanding Alzheimer's. Next, we have Nurses Christian Fellowship, which I was actually a part of being in college. A professional organization that provides resources, Bible studies, and the Journal of Christian Nursing to help nurses integrate faith and nursing practice. So they provide Journal of Christian Nursing, which offers a clinical and professional insights from a biblical Christian perspective, which is really interesting. Members receive this quarterly with full access to understanding content, including JCN archives back to 1984, as well as resources about professional development and biopsychosocial spiritual beings and understanding spiritual care. The student membership is about $80 annually.
Parish nursing earns about, on average, $79,000 a year. Cities based in like Northern California have a higher salary due to higher living cost, as it is known as the technology hub in California. As one can see, all the cities listed are in the Bay Area, and the salaries average around about $90,000 a year for a parish nurse. The information received or recovered was from a job recruiting website. According to Salary Expert, the average nursing salary for an experienced parish nurse is $93,000, where an entry level is closer to $67,000. Salary Expert utilizes the Economic Research Institute, a company that compiles salary and cost of living data for over 35 years. So as you can see here, this is a 5-question interview guide for parish nursing. The first question that can be asked when interviewing for a parish nursing position would be asking what faith means to a person, as it is an open-ended question and can open up to a person's personality. The second question is talking about the meaning of spirit, mind, and body, and how does a nurse incorporate that in their care. The last 3 questions are situational questions to get a sense of a nurse's compassion. The questions are: when is the time you used active listening? What would you do if a patient has different beliefs, seek spiritual care from you? And lastly, how would you help a lonely church member? These questions can filter out whether the nurse is compassionate and is willing to create genuine connections with the community, as opposed to practice faith-based nursing to fulfill an agenda, such as promoting one's beliefs. So we have an example resume for a parish nurse. So on the top, we have professional summary. Keeping it 1 to 2 sentences usually keeps the reader interested. Then we have the core competencies. These are employer-desired skills, and they're very important to include. Skills include praying, active listening, advocacy, holistic care, and spiritual care, to name a few. Then we have your education, and then on the right-hand column, we have your experience, and then we can go into your license and certifications, and then very important to include some volunteer experience because it shows off your soft skills and that shows character to employer, such as working with like a church or outreach to the community. It shows a lot of character to your employer.
Hi, this is Rachel again. I'm showing our brochure for a nursing job, now hiring at $45 an hour. This is for faith-based nursing. Serve in an on-site office or visit members in a healthcare facility, private home, or other community setting. And the job is to promote whole person, whole being, and focus on faith, harmony, and wholeness. And you can make friends, and there's 2 journals, Journal of Faith and Faith Community Nurses International.
Are you ready?
Hi. Yeah, we're in the middle of dinner right now, but that's fine. I've got my kids running around, but it's okay. I can do
Oh,
the
do you want to reschedule for
No,
another
no, no,
time?
it's okay. We can do it. Yeah.
Oh,
No,
okay. All right. So this job is faith-based nursing. I don't know if you're familiar with it.
I've heard a little bit about faith-based nursing.
So I'm just going to ask you some questions about what your faith means to you personally.
Well, I'm an atheist,
Oh, okay.
but I need a job. So I thought I would apply. And everybody has different viewpoints and everything, but the pay is good. I saw on the listing, so
Yeah, it's 45 an hour. Is
mhm.
that is that
And
good
I'm
for
a new
you?
grad, so I need a job. So I'm willing to take anything.
Oh, okay. I'm gonna, when I say spirit, mind, and body, what does that mean to you?
Um, Spirit, mind, and body. I'm not too sure. Yeah,
Okay.
I'm not too sure what I would make of that.
Could you give me a time where active listening was used in your nursing career?
Mm-hmm. Listening to all the patients.
Yeah, yeah.
Well, I've got many, many examples.
Where did you work before?
I'm a new grad.
Oh, okay.
So I've only had my clinicals.
Oh, okay.
Put that down. Sorry, my kids are they're crazy.
It's okay. That's okay. I
Sit down.
understand. I have a son.
Oh.
What would you do if a patient was seeking spiritual care, has different beliefs from you?
I would probably just tell another nurse to take over.
Oh, okay. And how would you help a lonely church member?
A lonely church member?
Yes.
Oh, I don't know. I don't go to church.
Oh, okay. So what inspired you to pursue faith-based nursing? You said you need a job.
I just need a job pretty much. Yeah.
So have you worked with any pastors, ministry leaders, or healthcare providers?
Oh God, no. I stopped going to church when I was like 16. Yeah.
If a patient asks you to pray with them, how would you respond?
I would be respectful. Just tell them, I don't really pray, but I could get a nurse who does.
Okay. Do you have any questions about the position?
Yeah. Do you guys have an air fryer in the lunchroom?
No, we don't, but we should get one.
Yeah, air fryer. And do you guys provide coffee?
Yeah, we have the Keurigs.
Okay. No, that's it then.
Okay. Thank you for your time.
Take care.
Okay, bye. Bye.
Hello, Julie. My name's Anthony.
Hi, good morning. Thank you for your time.
Good morning. Thank you for being on time. So I am the director of Titan Hospital, and I'll be interviewing you for the parish nursing role that you applied to.
It's so nice meeting you.
Awesome. Okay, so let's get started with this interview. What does faith mean to you?
Faith is, for me, it's central to everything that goes on in my life. Everything that I go through, every trial, every valley, every hilltop. Faith is something that helps me get through those times. And it's something that keeps me grounded.
Awesome. So when I talk about spirit, mind, and body, what do you think about that, and how do you incorporate that into the broader community that we serve here?
Yeah, so I'm a big believer that your spirit and your mind affect your body. Like when you're stressed, you tend to have like symptoms, anxiety, you have symptoms when you have a higher heart rate, things like that. And, um, you know, the spirit and the mind, they do affect us physically. So I'm a big believer that instead of just treating the physical body, we also have to treat patients' spirits and minds as well.
Okay. And then how about, can you give me a time when you use active listening in your nursing career or during clinicals?
Yeah, definitely. A time when I use active listening, let's say it would definitely be when there was a teenager that everybody kind of avoided because she was a little bit difficult, a little moody. Those hormones are going, and a lot of the nurses didn't really like to talk to her much. They kind of just left her to herself. But I was just getting to know her and kind of having a conversation with her. And she opened up to me about a lot. And I was just listening. And she told me that I was the first person to listen to her. And she thanked me. And it ended up, we built a really good rapport.
That's awesome. Building therapeutic relationships is very key in parish nursing. Okay,
Yep.
so the next question I have for you, what would you do if a patient seeking spiritual care has different beliefs than you?
That's a good question. I would ask them what their beliefs are and how they usually cope with whatever it is that they're going through and just encourage that. For example, if they like to pray, then I would encourage them to pray. If they like to meditate or whatever it might be, then I would encourage them to do so and tell them that we support them, and however we can be there for them, we definitely will.
Awesome, good. So, and then my second to last question would be, how would you help a lonely church member?
A lonely church member?
Yes.
Well, one of the biggest things is befriending people. So I would just go up to them, introduce myself, and just ask them about themselves and what their story is, and they could share as much as they feel comfortable and kind of small talk at first, getting to know them. And also, it helps maybe introducing them to someone else, maybe just one person, just to kind of get them familiar with another person.
Awesome, that's a good question. Okay. All right. So, my last question is, how would you integrate spiritual care in evidence-based nursing practice?
Yeah, so let's see. With evidence-based nursing practice, I would say incorporate coping mechanisms or spiritual things that would help the body. For example, prayer and meditation could help lower somebody's blood pressure, kind of take that anxiety down, lower those stress levels. Thus they wouldn't have like that high heart rate anymore or feel on edge. And there's a lot of things that we can do spiritually to help our bodies physically. And with cortisol levels and all of that is all related. So there are therapeutic remedies that might not always involve medication. And so that's something I'm a big believer in.
Okay. All right, Julie. So thank you so much for interviewing with Titan Hospital. Right. So you'll be hearing from me in 1 to 2 days. Be on the lookout for an email. It'll be sent to your personal email. And if you don't have any other questions, we'll just conclude the interview. Thank you so much for your time.
Thank
I
you.
really
Thank you for
appreciate
your
you.
time. Yeah, take care. Have a great day. I hope to be hearing from you soon.
All right, Julie.
Take
Bye
care.
bye.
Bye.
Thank you so much for watching our presentation, and here are our references.